So this weekend is the annual in-training exam for anesthesia residents, also known as the ITE. And the ITE is put out by the ABA, or the American Board of Anesthesiologists. And every year after this exam is given, they release what's called the gaps in knowledge. And the gaps in knowledge is basically commonly missed questions on the in-training exam. And it's usually something that they want to drive home so that residents know about it and it's not forgotten about in subsequent years. The benefit of reviewing this is that they commonly test these same topics in subsequent years. So what I'm going to do in this next segment is go over the gaps in knowledge for 2022, 2021, and 2020, and hopefully help you guys get some easy points on the upcoming test this weekend. So in 2020, they cover 5 different points for the gaps in knowledge. The first being when Propofol is run at an infusion rate of 15 mics per kilo per minute. It has bronchodilatory effects as well as respiratory depressant effects. The second point that they cover is that among the different causes of cerebral edema, corticosteroids are most effective at reducing vasogenic cerebral edema. The next point that they cover is that inhaled anesthetics will have an increased pharmacodynamic effect on patients with cerebral palsy. Next, they state that the increase in creatinine clearance that you see with pregnant patients will return to normal values after 8 to 12 weeks postpartum. And finally, the last point that they hit for 2020 is that the addition of epinephrine in Bupivacaine does not have that much effect in increasing its duration of action. So in 2021, there were 9 different gaps of knowledge that they cover for the ITE. The first one is the curve between alveolar ventilation and PaCO2 has a specific type of shape. It's a negative exponential curve. So when there's 0 alveolar ventilation on the x-axis, the PaCO2 is very high. And then as you start to increase alveolar ventilation, there's a sharp decrease in the PaCO2, and that will start to level off as you increase alveolar ventilation. Next, myopia or nearsightedness increases the risks associated with doing a retrobulbar block. Next, the onset of action for Remifentanil is different for a geriatric patient versus a middle-aged patient. Next, Neurapraxia or a nerve injury resulting from trauma is something that you would not expect in diabetic neuropathy. The next point is that splinting from an abdominal incision will increase the airway resistance for small airways. The next point is that a loss of surfactant is a complication of freshwater drowning in terms of pulmonary physiology. Next, the ganglion impart block is a good treatment option for radiation-induced proctitis. Next, gamma radiation is appropriate for immunodeficient patients to prevent graft versus host disease from a blood transfusion. And finally, spontaneous ventilation will improve in the supine position compared to the sitting position in certain spinal cord injuries. In 2022, they pointed out 7 different gaps in knowledge for the ITE exam. The first being that during transsphenoidal resection of a tumor, it's beneficial to have hypercarbia because you're going to have an increase in CSF pressure, which is actually going to push down that tumor to have better visualization. The second point is that in full-term pregnant patients, you're going to see little to no difference between a PaCO2 and an end-tidal CO2 tracing, and that's because there's very little to no dead space ventilation. The third point is that hypoglycemia is an important consequence of reperfusion after pancreatic transplant. The fourth point is that spontaneous abortion is a potential consequence of receiving a general anesthetic in the first term of pregnancy for a surgery such as an appendectomy. The fifth point is that the primary motor cortex sits anterior to the central sulcus and the somatosensory sits posterior to the central sulcus. I remember this because M comes before S in the alphabet. The sixth point is that in the ACLS guidelines, procainamide is a medication of choice for treating stable wide complex tachycardias. The key point being here that it's stable, so it has a normal blood pressure associated with it. And finally, the last point that they have is that laryngeal trauma is a major contraindication to jet ventilation, because with jet ventilation you use high pressures and that can cause increased trauma to the larynx.